All right. Well, welcome everybody to our information section on Phase 2 with Alan Harris, Seminole County's Emergency Management Manager. Most of you know him. He's had a more than 20-year career in doing this. He's a fellow Gator. We both worked the 1998 wildfires together. Believe it or not, Alan, I don't know if you know that. I was a volunteer firefighter in Melbourne at the time, long time ago. And want to thank AT&T for their sponsorship of this message this morning. As Rebecca mentioned, Alan has somewhere to be, so the way we're going to do it is I'm just going to let him go going, and then as we have questions, you can throw them up in the chat box. If we don't have time to get to them, we'll collect those, get back with Alan after today, and then get those answers back to you. But we are entering Phase 2. However, it's not without some hiccups. Normally, when an organization like ours has Alan on at the beginning of June, it's to talk about hurricane season and tax-free holidays and that sort of thing. But 2020 is unlike any other year in history, I believe. And so with that, I will turn it over to Alan for your update this morning to the Seminole County Chamber. Thank you, Alan.
There we go. Can you hear me? All right, great. Thank you, Jason. Thanks, everybody, for having me today. I really appreciate the opportunity to speak with you folks at the Chamber. We're here in the Emergency Operations Center where we have been for now over 90 days, responding to the COVID-19 situation. Here in the EOC, we have a couple different units. One of the units, it deals with COVID-19 individuals that are inside of their homes. So we contact them each and every day to check on them, check on their well-being, to make sure that they're okay. If they need any supplies, we try to provide those supplies through support from our nonprofit organizations. So that can include delivery of food services, if they need medication, providing medication to the individuals, as well as we even have gone down to pet care. So if they have an animal that needs assistance, so that they don't have to leave their home and go to the vet or go to a pet store or anything like that, we actually work with our animal services department to deliver items directly to their home. Funny story, this is the first time ever in an EOC activation that we've had crickets delivered to a home, literally live crickets delivered to a home for a pet frog, but the individuals had to feed their pet frog. We didn't want them to leave the home because we didn't want the virus, of course, to spread. So our animal services department picked up their crickets from the pet store and actually brought it to their house, put it in front of their very interesting type of delivery system for that one. But we were providing as much assistance as we can to individuals in their homes so that they can stay in their home, they can isolate, they can quarantine so that we do not spread the virus. There are some good things. We truly, in the leadership team in Seminole County, believe that we can reopen and be safe at the exact same time. Both can happen simultaneously. It is important to note that Seminole County never issued an executive order that closed any businesses. That's not something that we did. The state of Florida did that as a precaution, listing some essential and non-essential businesses, but Seminole County never did that. Our executive orders were related to social distancing, and we still feel that that is very, very important. We encourage individuals and businesses to have markings on floors of queue lines. I think that we have seen a great response from Seminole County and making sure that all the Seminole County businesses and making sure that that has been taking place. We encourage frequent hand washing, of course. The normal stuff that CDC requested, we put into our executive order. The one thing that we added to our executive order was that in businesses where you work in very close proximity, that would be like hairstylists, massage therapists, nail salons, tattoo artists, folks like that, the individuals wear facial coverings. That is still a highly recommended. It is not a requirement anymore as we get into phase 2, but it's still highly recommended by Seminole County leadership. So if we do those things, we can really move into phase 2 and phase 3, and we believe we can prevent the spread of this virus. And unfortunately, we have seen the news, we have seen what went on over Memorial Day and things like that. And while a lot of people are following that good practice that's being suggested by the CDC and by the World Health Organization and by the White House medical team. Unfortunately, there are folks that are not heeding to that. They are not wearing the facial coverings and masks when they're in social gatherings. They are ignoring the queue lines and getting close in close proximity with individuals. And we have seen an uptick in number of cases. But let me talk about the good first. What good has happened lately is our personal protective equipment is starting to come in much faster, which is excellent. We are able to deliver personal protective equipment to assisted living facilities, nursing homes, and healthcare workers. They can't get it through their normal means, so we are being able to provide them. While it is still challenging to get certain items like cleaning wipes is still hard, hand sanitizing equipment is sometimes hard, gowns and N95s are not real easy to come by. Other things are. Like surgical masks and eye protection and facial coverings and disinfectant cleaners are much more readily available than before. So that's some good news. Another thing that's really good, over the last 2 weeks, we have not had an additional fatality in Seminole County. So that's good news as well. We went up to 12 fatalities, and then we've held strong for multiple weeks now. So that's good news. Of course, it's unfortunate for those 12 individuals, and we feel for the families of those individuals and pray for their comfort and healing during this difficult time. But it is good information that we have not had any additional in the last couple weeks. While our hospitalizations have gone up a little bit, they have not gone up significantly, which is also good news. So we are still maintaining a relatively low level of individuals that have to stay overnight in the hospital. We are seeing a lot of individuals that are coming into the ER, and that's primarily because they're sick, they're not feeling very well, they don't know what's going on, they get a test, and then they're sent home because they don't require the overnight hospitalization. And that's similar to any of us that have ever been to an ER. If we don't present a symptom that requires constant monitoring by a nurse, of course, we're going to be sent home. So it is good that our hospitalizations, overnight hospitalizations, continue to remain relatively low. While they are increasing, they continue to remain relatively low. So I told you the good news here is the news over the last 5 days. And it's unfortunate, but we've had over 94 new cases. I hear right now that we're putting in another 28 additional new cases of COVID-19 this morning. So that's a lot of cases. At our highest count so far to date, before this last 5 days, our highest count for a daily increase was 23. Just 1 day ago, in a 24-hour period, we had 34 new cases added to our call list and the people that are isolated and quarantined in their homes. So we are seeing an uptick. We're seeing it quite dramatically here in the county. Again, we want to emphasize that it is okay for us to open up. It is okay for us to move into phase 2 as long as we follow these safe practices. And from the contact communication, we don't do contact tracing, but the Florida Department of Health does contact tracing, which means that they talk to everybody that has come back with a positive test result, and they see if they have been in contact with anyone else to let those individuals know, hey, you've been exposed. You'll probably just want to monitor yourself to make sure that you don't come down with any symptoms. Check your temperature daily, things like that. If you notice anything that's starting to get out of whack, certainly reach out to a doctor or an urgent care clinic so we can get you a test right away. So that contact tracing is being done for all those individuals. Now, as part of that contact tracing, they ask some questions, and 95% of the individuals that they've asked so far have said that they indeed have kind of been lax on the hand washing. They've been lax on the facial coverings and masks. While they did that about 3 or 4 weeks ago, they just kind of stopped doing that. They have started to get in social gatherings. Many of them talked about pool parties and things like that that they attended over the Memorial Day weekend. And this is about the time when we would see those cases come in. So it is exactly what we kind of anticipated, not quite to the numbers that we're seeing. We were hoping the numbers would be a little bit lower, but we did anticipate a little bit of a bump after the Memorial Day weekend. And it's important to note that the increase in cases is not due to increased testing. Actually, the demand for drive-up testing has gone down. And I think that's just because people are going back to work, people are getting back into their normal life, and they just don't have time. If you feel good, why go get a test? You know, if I feel great during flu season, I don't run down to the doctor's office and say, hey, you know, I'd really like one of those flu tests. And when we're seeing that, a lot of people aren't wanting the COVID test because they feel great, they're busy, they're getting back to work, they're trying to reopen their business and things like that. So where we were testing people quite frequently, so we 3 weeks ago, 4 weeks ago, we were testing at 3 different pop-up test sites every single day of the week. Well, the demand decreased so much that maybe 1 or 2 a week. So this week we're doing 2. Last week we actually did 1. So while the testing in the county has actually gone down, the positivity rate is going up. So that again illustrates the importance of social distancing, facial coverings, wiping down common surfaces, things like that. We, again, believe in this county that we can open up. We believe that we can, Seminole County has never issued an order where we have required businesses to remain closed or anything like that. We can absolutely reopen this community, but we have to do it safely. And as we get into hurricane season, of course, we're also in phase 2. So we're looking at what will COVID mean during hurricane season. So there's going to be a lot of changes related to that. So if you need sandbags, the sandbag locations will have social distancing. There will be queue lines, so patients during that time period. Sheltering will be vastly different because of COVID-19, where we would put people, and everybody's seen these images where people are all in high school gymnasiums and cafeterias and things like that, side by side. That just can't happen this year. So now we're looking at classrooms and smaller groups of individuals and more schools and spacing out individuals so that they're not right next to each other, that we're creating that social distancing inside of the emergency shelter and triaging before people are transported to those shelters. So if people need assistance with transportation to the shelters, that we are checking with them and that they are the temperature checked, and we ask questions related to any type of exposures and things like that before they even get to an emergency shelter. So these are safety precautions that we're taking during hurricane season. And as we get into phase 2, I think it's important for businesses to also look at around your business. How can you I think we have, I was a private business owner for a little while, and I didn't have very many employees. I did a little medical training business, but it was very important for me to keep my employees healthy and safe. So we have a job, of course, to the patron, and I had a job, of course, to the patrons, and I also had a job to my employees, and so do us as business leaders. Things are, as we reopen, we're going to have to think about things. Also, we did a consumer competency rating survey here in Seminole County just to see how people felt about getting back out into the community. And overwhelmingly, people look at businesses to see what practices they have inside of their business. They probably will not complain. They probably will come in, and we've heard this. We saw it in the survey. We've seen this. Orange County did a very similar survey, and their results were very, very similar to Seminole County. People don't make a lot of complaints. They'll just come in, they'll look around like, yeah, this is not a safe place. I'm not coming back. I'm just not coming back. And we don't want that. We want people to come back to Seminole County. We want people to come to Seminole County businesses. We want them to feel safe and secure. We, again, believe that we can open up businesses and we can open up our community. We're opening up Seminole County government. We have opened up most of our business offices. We have opened up most of our libraries. One library is just a larger library. The Central Branch Library will open up next Monday. So we are with you all in that we believe that we can reopen, but we had to take precautions, right? So our precautions included putting up plexiglass. Our precautions included facial masks and coverings for individuals that are working inside of our facilities. That we are, if you go into the county administration building, if you don't have a face mask or covering, you're given one, and said, hey, you need to, if you have one, please go back to your car and grab it. If you don't, we're going to give you one before you come into the building and start interacting with the employees, because we have a responsibility to all of our residents to stay open and operating, and we only can do that if we protect our employees. So we're taking those precautions, and we hope that business leaders will take those precautions as well. We can get through this together. Seminole County is a very resilient community. We have shown our resiliency. We've shown our resiliency during multiple hurricanes, the floods of '08, the wildfires of 1998. We have been certainly tested and tried, and we always come out of these events stronger as a community, and I think we can as a community. So with that, I'll turn it over and see if there are any questions. Or
We haven't had any pop up in the chat yet, but Alan, while we've got you on the phone, you touched on it briefly. We've been so focused on COVID, and hurricane season has started. And so, as a brief reminder to the folks out here, what is it that they can do to begin preparing? We just had our tax holiday pass, but for those that have forgotten to check batteries, what have you, what are the important phone numbers they should have ready? What other things should they be looking at as we get into that?
Yeah, so one of the most exciting times of my year is our Hurricane Expo. So our Hurricane Expos are generally in malls, and it's an opportunity for us to go out and to communicate with our residents. They can ask us questions. They come up to our booth, and it's a real fun time for me because I get to interact with lots of residents and answer questions. Unfortunately, this year that's kind of impossible, right? We don't want to bring large groups of people together. So this year, what we did is a virtual Hurricane Expo. So if you go to our website, prepareseminole.org, again, prepareseminole.org, there are two dashboards at the very top of the website. There's one, the COVID dashboard, which is a great dashboard where you get a lot of statistics on what's going on currently with COVID here in the county. And then the other one is Hurricane Expo. So you click on that, and there's a lot of different videos on how to prepare for the hurricane season. Everything from how to do sandbags to around your home, things to look at. I've got a honey-do list at my house as hurricane season is upon us. Fixing some of the fence line. There's a limb that's gone over the house that I need to trim back. Running my generator, make sure that is fully operational. Checking the plywood, making sure that that's okay for the windows that I need to board up, and those types of items around the home. I have checked my insurance policy, so I'm very covered with the insurance policy, but I even have flood insurance, and I don't even live in a flood zone. So that may be something that people want to consider. If you live, if you rent, you certainly want to look at renter's insurance. If you live in a condo, you certainly want to look at what in your insurance for your condo will cover, and then what you have to cover alone from the condo company or the condo association. And then buy your supplies. COVID taught us, we learned this lesson every single time, right? We know where the reporters are going to be right before a hurricane. Where are they going to be? In front of a grocery store and in front of a hardware store. And what are they going to show? Empty shelves. That's what they do every single time, right? We learned it again in COVID. I don't understand the toilet paper. I still don't get the toilet paper thing. The cleaner I get, but I don't get the toilet paper thing. No one has been able to explain to me why thousands of people needed every little piece of toilet paper in the world. But we learned that lesson again, right? So we also understand that this is a very hard time economically for people. So what we're suggesting is for the individuals that can go out and get disaster supplies, now's a good opportunity to do that. And what that does is that helps the supply line. So for those people that can't afford to get supplies right now, when they absolutely need to, as the hurricane is approaching, then at least they have an opportunity to get supply because the supplies are there. If we all wait until the hurricane is approaching, then there won't be supplies available. And I don't ever suggest people go and get all their disaster supplies at the exact same time. Instead, each time that I go to the grocery store, each time I go to the hardware store, I buy a couple extra items. I probably have the best disaster kit in my entire neighborhood. I really feel that I do. And I'm not even going to be at home during the disaster. I'm going to be here in the Emergency Operations Center, but at least my family's taken care of, and that's what's really important to me.
Perfect. Thanks, Alan. Well, we've had a couple of questions come back in about COVID. One is, are we noticing any common category or circumstances where there's a large number of positive tests coming in? Certain kinds of congregate activities? Is there any pattern that we're able to notice now that we've seen a little bit of an uptick?
Yeah, so from the last weekend, most of the individuals that we've talked to have said that they were in parties and gatherings and things like that. They freely admit, yeah, you're absolutely right. I feel miserable now, and I wish I had thought about it and it was really around the Memorial Day weekend, which makes sense that the incubation period is about 10 to 14 days. So this is about the time that we would start to see those. So most of those are individuals that have gone to gathering locations, getting with groups of friends and things like that. No facial coverings. No, all of them have said no facial coverings, no masks. We all got together, pool parties and other types of social events. And we're not telling people don't do social events. We're telling them, you can do everything safely. We can reopen safely. We can do activities safely. You can go to church safely. We had a couple workshops with faith leaders talking from faith leaders to faith leaders, talking about how we can reopen church services safely. And there's absolutely ways to do that. Certainly facial coverings and masks while we're all singing at the exact same time, and we're expelling normally pretty loud in some churches. My church were pretty loud at the exact same time. So we're all breathing on each other at the exact same time. So making sure that we're socially distanced, not only side to side, but pew to pew as well. So those are types of things that we can think of now.
And sort of a related question to that is then that as long as we're adhering to those things, you're not noticing a result of indoor dining being one of the causes, but really just a congregate party where people just aren't doing the activities. Okay.
Yeah, absolutely. You can go to a restaurant. I mean, we have since the beginning also have suggested, even when the restaurants weren't open, to do the takeout. They were open, but to do the takeout. Certainly, we want people. A lot of retails stayed open for curbside only pickup, and that was okay. So we strongly suggest to patronize your local restaurants, but consumers are going to. If you're a restaurant owner, consumers are going to come in. They're going to look around the restaurant. They may eat there that night, but if they look around and they're like, man, I don't feel safe here, they're not coming back. So, and especially seniors, people with underlying medical conditions, they're going to look around and go, you know what, man, they just sat at someone right next to me. I don't think I'm coming back. Probably not for a couple of years. Maybe when we have a vaccine, but maybe not. So those are things we have to think about.
Yeah, as a business owner, you certainly don't want to be the place the news focuses on as the hub of a spread. So
Absolutely,
we're all being very responsible in that regard. One last question before we let you go. What are your thoughts on kids going back to childcare? I know in phase 2 that's covered as one of the accepted activities, but what do you personally think about how that would go?
Yeah, and so I think it's important to know what the child care is doing. So we have Eco Camp coming up, so we're definitely going to run our summer camp. We have tennis camp coming up at one of the parks. So, but it's lesser groups of individuals. So you just want to ask the organizers, hey, how are you going to keep my children safe? Are you going to take their temperatures? You can get a temperature gun real cheap. So are you going to take their temperatures? Are they going to be in smaller groups of individuals? What are your cleaning? It's okay to ask those questions. It's our responsibility to ask those questions to protect our children, right? So certainly you could do that. One thing I forgot to ask or I forgot to mention was the CARES funding. So everybody's seen the funding that went to Orange County, that went to Volusia County, that 500,000 individuals living in your county or more, and you suddenly got money. But if you had less than 500,000, you didn't get anything. Everything went to the state. I'm very happy to report yesterday the governor has issued information on how we're going to get the money. So we're very happy about that. We have not seen exactly how it's going to be allocated, but there is money coming this way that will hopefully be able to provide some relief to some businesses.
And Alan, thank you for that update. We were kind of miffed that at 470,000 people, we just missed the federal updates. While Orange County is giving out masks to businesses and doing all this stuff, we just missed the cutoff for that. It was announced yesterday. Tina pointed out the governor's going to make a major announcement at noon today, but that might be related to that. It also might be related to him signing the budget. He's got about 2.5 weeks left to do that. It could be related to a lot of things, and he hasn't been real forthcoming with major announcements over the last couple of months. We kind of find out when you find out, but that is certainly happening. And Alan, I don't want to step on too much of your time because I know that you're going to another press conference at 10 o'clock, and so. One last question from Tina. Orange County, there's a requirement that small businesses had to have a minimum of 3 employees, not including the owner. Is it that way in Seminole?
No, we don't have any requirements like that. Currently, the only executive order that we have on the books is if you are COVID positive, that you have to stay in your home. That's kind of a logical executive order, right? We want people that are sick to stay in their home. So there is a executive order that requires that. We highly suggest the social distancing practices and things like that. That was part of our, that was another executive order. We had a second executive order related to social distancing and wearing facial coverings, again, only if you were in the close proximity type businesses, hairstyling, nail salons, things like that. But we have rescinded that as we went into phase 2. Still highly recommend it. Still clearly by the numbers, we believe that that is the best practice to keep us moving forward.
And Tina was clarifying she meant in order to receive some of the CARES money. And so do you anticipate that Seminole County will have some kind of minimum threshold for who's eligible to receive the funding?
Yeah, and so the interesting thing about the Orange County and the Volusia County, the ones that were 500,000 or more, they got to kind of establish what their criteria was going to be. We have not seen what the governor has sent to us, so the governor could put his own type of requirements on there. So we just heard yesterday that it's coming. So we're real excited about that, but we haven't seen the grant language, and you know, right, as well as I do, that sometimes those come with a lot of strings, and it says you can do this, you can use it for this, this, and this. So we don't know what this, and this is yet because we haven't received the language, but as soon as we do, know that we will be turning it around to help our businesses. And if there aren't any requirements, then we will have to look at how we're going to do that to make sure that we can help the most amount of people.
Yeah, all money is going to come with some kind of strings, and this governor has shown that he's not afraid to modify what is recommended. Right. He's also, in a lot of his communications with communities, recognized that rural counties are different than metro counties in terms of rollout. And I know we're right under the threshold, so I don't know how we'll get considered because we're suburban, we're pretty dense, but we're not 500,000. So it really will depend on what's there. Well, Alan, I want to thank you very much for being here. We're bumping right up on 9:30. If anybody has any additional questions for us, please make sure you get them to us. We'll be happy to get them to Alan. We wish him well on the rest of his hour, his day, and his week as it goes for an emergency manager, and really appreciate the time. Thanks to AT&T for making this happen. And again, if anybody's got any more questions, please let us know. We'll be happy to feed them back.
Sounds good. Thank you very much for having me.
Thank you all very much for being here, and we'll have another one of these coming up soon. So thanks much, guys. We'll talk soon.